Other complications, well, classically they are divided into microvascular and macrovascular. The typical microvascular complication being nephropathy, starting with microalbuminuria, then leading on to macroalbuminuria, then loss of glomerular filtration rate, eventually leading to end-stage renal disease, transplant or dialysis. Again, even there, microalbuminuria is a functional rather than morphologic finding, but it is highly powerful and highly disregarded risk factor for heart disease. Once a patient has microalbuminuria, they have a much higher risk of getting a heart attack or a stroke. So that should be, microalbuminuria should be considered not just a sign of renal disease, but some very bad sign of something worse to happen. Then, of course, neuropathy. Neuropathy is probably a mixed metabolic and microvascular complication. Probably the small vessels in the peripheral nerves have something to do, but then altered glucose metabolism in the peripheral nerves plays a major role. So the pathogenesis of neuropathy is probably slightly different from that of retinopathy and nephropathy. And then, of course, diabetes is a multiplier for heart and brain ischemic disease, and that we should keep in mind, particularly because the recent trials in type 2 diabetes have shown this apparent paradox that while diabetes with its high blood sugar increases, doubles, triples the risk of heart attacks, bringing back or bringing down blood glucose in diabetes does not reduce the risk for heart attacks. So there's something that is started by diabetes which is not easy to stop.